Here is a soul which has got all the simplicity of confidence. Doctor, whatever you say, I accept it. Here is an old lady who has got so much of faith in me, I must do my best for her. Now how am I going to train myself to do perfection?
Over 45 million people around the world are blind, and 124 million are visually impaired. 90% of these people live in the developing world, 12 million of them in India, where, for most, medical treatment is either unavailable or unaffordable.
In a way, blindness is a fatal disease in India. The life expectancy after blindness is 2.5 or 3 years. There's a bad expression in India, which is a blind person is someone who is mouth but no hands.
More than 80% of the developing world's blindness is preventable or curable. Yet in 1976, blindness was on the rise, but a visionary ophthalmic surgeon named Dr. Govindappa Venkataswamy, known as Dr. V, was, at age 58, retiring from the government medical college where he had pioneered mobile eye camps, as well as feeding centers to reduce childhood blindness due to nutritional deficiencies. Despite suffering from a rare form of rheumatoid arthritis, Dr. V set out to fulfill his dream of creating a non-profit eye hospital for the poor. So he founded the Aravind Eye Clinic, 11 beds in a rented house, financed by loans from family members and a mortgage on his home. Dr. V's dream soon evolved to become a worldwide mission for the Aravind Eye Care System, to eradicate needless blindness and to make high-quality, compassionate, and affordable eye care available for all. At first, Dr. V focused on diagnosing and treating cataracts, traveling to remote villages with a team of eye care professionals. His eye camps and rural clinics, supported by partnerships with leading international eye organizations, helped Aravind reach India's neediest patients who were never charged. Not for surgeries or other treatment, not even for transportation and food. Out of necessity and a shortage of funds, he began manufacturing his own ophthalmic equipment. At $200 each, imported intraocular lenses were too expensive, so Aravind now produces its own high-quality lenses, which today cost only $2 a piece. These are sold throughout the developing world, and Aravind now has 8% of the global market. Other products also contribute to Aravind's self-sufficiency. But India has the largest number of blind people in the world, and Dr. V was always striving for more efficiency and productivity. Intrigued by how the American corporation McDonald's maintained quality with high volume and low cost, he set out to study its methods, even attending Hamburger University.
See, McDonald's concept is simple. They feel they can train people all over the world, irrespective of different religions, different culture, different all those things, to produce a product in the same way and deliver it in the same manner in hundreds of places. Supposing I am able to produce eye care techniques, methods and all those things the same way and make it available in every corner of the world, the problem of blindness is gone.
To begin with, Dr. V had to address the lack of trained clinicians in his country. He persuaded his sister and brother-in-law to leave their lucrative practices in the United States and join him in building his dream. They were the first of 3 generations of Dr. V's family dedicated to Aravind. The training of eye care professionals soon became an Aravind mandate. Eventually, more and more physicians eager to train in the Aravind system joined the ranks, fueling the expansion of several new hospitals and clinics in the most impoverished areas of India. The team members were guided by the example of Mahatma Gandhi, his simple life, his truthful life, and his spiritual life. From the beginning, Dr. V established that patients would be charged according to their ability to pay, with 30% of its patients subsidizing the remaining 70% who could afford to pay very little or nothing at all.
And I don't insist upon that man must pay me before I do anything for him. I said, give the sight man, let him give whatever he can give. So priority is for human welfare.
To staff his growing number of clinics and hospitals, Dr. V recruited hundreds of young women from the local villages and trained them as operating room technicians, nurses, and counselors. Their skills increased efficiency in Aravind's assembly line approach, enabling the doctors to make surgery their primary focus. Today, Aravind's postgraduate courses in all ophthalmic subspecialties attract top medical professionals who wish to learn the latest techniques, to conduct research, and to gain experience by working in the largest eye care system in the world. Aravind's research laboratories cover the entire range of eye diseases, including genetics, immunology, microbiology, cellular biology, and biochemistry. As countries throughout the world seek to learn from Aravind's model, it has become a partner beyond India's borders, consulting with and training hundreds of hospital personnel throughout the developing world. In addition to India, Aravind has created national eye care plans for Rwanda and Eritrea. Its business model has become a case study for universities, and leading medical institutions in the United States and Europe send students to Aravind for training.
So we've just arrived. We've only been here for 2 days, and already being in the clinic for just a few hours have seen all kinds of pathology that I certainly have not seen in the United States and wouldn't necessarily have the opportunity to see.
More than 30 years after its humble beginnings in a remote corner of India, the Aravind eye care system has handled over 29 million outpatient visits and performed over 3.6 million surgeries. It is the world's largest eye care provider and trainer of eye care professionals, a leading research institute, and a manufacturer of affordable eye care products. All of this has been accomplished under the guiding principles of teamwork, respect for all, and compassionate care.
When we grow in spiritual consciousness, we identify ourselves with all that is in the world. So there is no exploitation. It is ourselves we are helping. It is ourselves we are healing.